And we are live.
Good afternoon and welcome to another COVID313 Community Coalition Town Hall. Here we are again on a beautiful day, the start of spring, and we are delighted to be bringing to you a really special program. But before we get started, I am delighted to share that I am Jametta Lilly, and I serve as the CEO of the Detroit Parent Network. I'm a mom, a proud Nana, and a proud member of this coalition that has been bringing you trusted resources and information to make sure that you stay strong and informed throughout not only COVID, but for the ongoing future. So we would love to hear from you. As we always do, we want you to know that we have a chat. So take a moment while you're getting settled in, whether you have your lunch or some water or some juice, and tell us, where are you connecting from? And how did you hear about the town hall? We really want to make sure that as you ask questions, and as we have our speaker today, you'll have the opportunity to ask questions. And if we can't answer them today, we will make sure that we get those back to you. So if you have questions, go ahead and put in your email address so we can continue to have a dialogue. So hopefully everybody is getting settled in. And I'd like to share with you that as we do everything with our coalition, we do it as a collaboration. And part of the joy of being part of this space is to have interpreters to make sure that we are including as many people as we can. So we really believe in equity and we really believe in diversity. And we show that by having some awesome interpreters. I'd love to have you meet our wonderful interpreter for ASL, who is Jennifer. And also joining us for Spanish is Cristina Guzman. So we're going to get ready to go into the program today. But today is precedent on some really remarkable things. One is that May is the National Mental Health Awareness Month. In addition to that, it is the National Women's Health Month. And as we can imagine, and perhaps we can imagine, because who would have known that in this period of time, we would still be talking about COVID and how it's been impacting our lives, but not only our health, but also our social emotional health. And we know that women's health, but women, we birth the world. So this is a very important month, not only for us to look at women as a whole in terms of our health, our mental health, our well-being, the way that we nurture and raise families and take care of communities. We also want to say to everyone else out there that we hope that you will be celebrating with us, to love on, support, and uplift women, in particular women who are nurturing others, whether that's the mom, a foster mom, an adoptive parent, a big sister, an auntie. The role of women nurturing is what we're lifting up, particularly as we think about the upcoming Mother's Day. So we hope that you are getting settled in. We want to remind our presenters, we have some awesome presenters joining us. Please make sure that you're speaking slowly enough for our translators. And to our audience, we will also be opening up for questions. So don't forget, you can put your questions in the chat, or if you're joining us from Facebook, put your questions or comments, in fact, in Facebook. We would love to be able to hear from any of you. So we're going to have wonderful presenters joining us to talk about health, from particularly the angle of women and the impact of how COVID and health disparities has been disproportionately impacting women's health. And we're going to talk about mental health, which is our social emotional well-being, all the way to the realities of those who have acute mental health issues. And we're really pleased to have a number of people. But like we always do, we know that what brought us together was focusing in on health. particularly with the devastating impact and the ongoing trying to navigate COVID. So who do we bring to the table? None other than our Detroit Health Department. And we're so pleased to welcome back, as always, Nurse Tanea Hackney, who has been keeping it real, keeping us informed in the community everywhere to answer questions that people have about COVID and staying safe. Welcome, Tanea.
Good afternoon now. Thank you. We thank you for allowing us from the City of Detroit Health Department to always be able to participate and give updates and share the resources that we have pertaining to COVID. I'm going to share my slide and give a little bit of where we are today as far as COVID, so we can get a bigger picture of where we are. So as of right now, I would say as of Monday, the positivity rate for Detroit since the pandemic has started, we've seen over 127,000 confirmed COVID cases. We've seen at least over 3,400 confirmed deaths related to COVID. And if you look at the right side of the screen, we're looking at our positivity rate as of last week. Now, we know just a few weeks ago, we were down to like 1.9%, but our numbers are going up. And that's because we're still dealing with COVID. We actually have Omicron that's present, but it's a baby Omicron, B2, that's still more transmittable. It's spreading. And when we look at our vaccination rates, the city of Detroit is just not covered. Right now, St. Clair is 14.5% positive, Macomb 10.9, Oakland County 14.8, and Detroit City right now is 9.1. When we look at Michigan, 9.7% is something to even fathom that our numbers are going higher, because we want to keep them down low, and it's spring and it's getting ready to be summer. And what can we do, to keep these numbers down? And that's why it's important for us to keep talking about utilizing the tools that we've been using, getting vaccinated. Social distancing is still important. Still utilizing your mask is still important. Hand hygiene is still important. The vaccination rate for the city of Detroit, when we're talking about, at least getting vaccinated with one vaccine, is 49.8%. When we look at other counties, we can look at Macomb, 65%, 77.8 for Oakland, 77 or 74 for Outer Wayne. Those numbers are high. And you might be asking the question, well, if their numbers, their positivity rate is a little higher, their vaccination rates are a little higher, but guess what? They're not as sick. And that's the most important thing we want to remind people. When you get vaccinated, you're protecting those that are not able to get vaccinated. You're keeping people from getting severely ill and increasing those death rates. That's what we don't want to do. So we also have a number for the city of Detroit to get COVID testing. Call 313-230-0505. For that number, you can also get scheduled for vaccines for COVID-313. COVID vaccines. The United States is still offering Pfizer, Moderna, and Johnson & Johnson. If you have any questions related to vaccines, we still have a way for you to contact us. The nurses line, you can call us at 313-874-4444. That number is just for individuals to call and ask questions to get your COVID results for testing. We still service homebound residents in the city of Detroit. So if you're homebound, there's no excuse. We'll come to your home. It'll take 30 to 40 minutes. A nurse will come and vaccinate you and your household. We want to make sure that we're vaccinating our kids, because their vaccination rate, unfortunately, is low. So we want to be able to have plenty of ways to vaccinate them. Northwest Activity Center is open. Detroit Health Department at 100 Mack Avenue is available. And we just got DHD pop-up immunization clinic for the city of Detroit at most of the rec centers for the whole summer. If you need a list of this, please contact us. All summer long, we'll be vaccinating with not just COVID, with any vaccines. If you're not sure, because we've kind of fallen behind of not keeping up to date with taking our vaccines or going to see the doctor because it's so hard to get in right now. If you're not sure, we'll have someone who can bring up your immunization records, adults and children. I just got 2 vaccines last week when I was at Adam Butzel. So I needed my Tdap and MMR. But if you're not sure, we have to protect one another. Get vaccinated. I'd like to remind everyone to stay in control because anxiety, pandemic fatigue is still a thing because we're still dealing with COVID. How can you stay in control? Take 1 minute, take a deep breath. Check your surroundings. Check your surroundings. That's one thing we can do, Jametta. We can stop and take a deep breath. Right. Check your surroundings. DetroitMich.gov. You can go on that site and I'll give you a QR code so you can actually check the data around you. You can check the zip codes around you so you can know where the number of positivity rates near you or an event you might be going to. Utilize your tools, masking, hand hygiene. If you can get vaccinated, it's very encouraged. Social distancing is still encouraged. I see you with your hand up, Mr. Meta.
Yes, Tanea. So one of the things that you mentioned earlier is that we are still challenged with not enough people in the city of Detroit have stepped up to say, I want to protect myself and my family by getting vaccinated. And thank you, Detroit Health Department, Wayne Health, and others. You know, you were there for immunizations for our children at the DPN event that we had, Young Inventors Expo, and you've been out at a lot of others. But here's a question that we're hearing. When is the vaccine going to be available for children 5 and under? Any information on that before we wrap up?
That's a good question, Mr. Meta. So Moderna actually just submitted their data to the FDA for their 5 and under children. So we're waiting to see what the results of the FDA approval or what their recommendation is. But Moderna just did that. I would say about a week ago. So we're waiting. Yeah.
We're waiting, but we don't have to wait on all the things that you just said to keep us safe, to stay masked up, social distancing, and making sure that we are breathing and staying focused on our mental and emotional wellness. Yes. Tanea, thank you for keeping us always informed. You know that we're going to be calling on you again because we've got to make sure that our families and our community is safe, and data informs us to make good decisions.
Yes.
So we're going to shift now from not only making decisions around health, but there's something else that we need to do, which is to be able to celebrate those wonderful things that go on in our community. And so I'm going to pass the baton now to our co-moderator, the infamous Christine Bell, who's been in this journey with me. Christine, please come on and introduce our next special speaker to talk about a very important holiday.
Jametta, Christine actually isn't able to hop on.
No worries.
So we need to run the show.
Yeah, we can continue to do that because that's what we do. We partner with each other. So drum roll, the next presentation, really pleased to bring on with us is Raquel from talking about Cinco de Mayo. And people hear this all the time, but what does it really mean? And Detroit Hispanic Development Corporation is one of the most critical organizations serving Latinx communities, along with Congress of Communities and others. But we're always so happy to have DHDC join us. Raquel, welcome, and please share with us about Cinco de Mayo.
Hi, thank you so much for the introduction. My name is Rachel Marquez. I am the Environmental Justice Coordinator for DHDC, and thank you for having me to talk about Cinco de Mayo.
You're welcome, and apologies for mispronouncing your name.
It's all good. Raquel works as well.
Okay.
But I just wanted to first say that Cinco de Mayo is not Mexican Independence Day. Mexican Independence Day is actually celebrated on September 16th and was when Mexico announced their independence from Spain in 1810. Rather, Cinco de Mayo is a celebration of the Battle of Puebla, which happened in 1862. So I want to give a little bit of history on this. At the time, Mexico was trying really hard to remain their independence as a country. Like I just mentioned, their independence was in 1810, so they were not independent for about 50 years whenever the Battle of Puebla happened. But on top of the fight for independence, they were also having to deal with the Mexican-American War and where the border of the United States and Mexico was. On top of that, they were also having to deal with their own civil war that happened in 1858, just having to decide on the politics within Mexico, specifically how much power was given to the churches and to the military at that time. So Mexico was trying really hard and fighting in a lot of battles at the time. And with war comes a lot of money. So they had to borrow a lot of money from foreign European countries, namely France, Spain, and Britain. And Benito Juárez, the president at the time, he announced a temporary pause on repayments just because he wasn't able to do it at the time. And that did not settle well with Britain, France, and Spain. So they sent troops within Mexico to try and get their repayment back. Spain and Britain were able to negotiate with Mexico and get a repayment plan set up. However, France saw an opportunity because of all the strife happening in Mexico at the time to try and create a French empire within the country. And then that started the Franco-Mexican War. And the Battle of Puebla, May 5th of 1862, Mexico was quite outnumbered by the French army. The French had 6,000 men versus Mexico with only 2,000 men at the time. So the odds were very much against them. However, Mexico came out victorious at the end, and Cinco de Mayo became a battle cry for the rest of the war that was lasting for 5 years later. So Cinco de Mayo, although it is not an Independence Day, it is a reminder to a lot of Mexicans on the resistance and the ability that even when odds are against us, that we can come through. So I do want to mention that in the United States, there is a lot of confusion as to it being Mexican Independence Day. However, America doesn't really want to recognize Mexican Independence Day because there was a lot of fight on exactly where the territory was being drawn. However, it's not to discredit the meaning of Cinco de Mayo to people. Even though Cinco de Mayo is a minor holiday in a lot of Mexico, aside from the state of Puebla, for us Mexican and Mexican Americans within the United States, it is a day for us to commemorate our Mexican heritage. And it is a reminder that even when times get tough, with persistence and with unity, we are able to make it through. So thank you.
That was awesome, Rachel. And I think you did a lot of great information and dispelled some of the myths that have been out there. I see some of the other expressions and people are going, Oh, I thought Cinco de Mayo was this. And that again is part of the beauty of this program, is that we are always trying to make sure that we're including diverse voices and lifting up information again to keep us informed. Because the more that we're informed, the better decisions that we can make, and hopefully recognize that all the information that we need is not on Facebook or TikTok, but it often comes from trusted experts like yourself. So continuing in the vein of talking with trusted experts, really so pleased to have join us again is Dr. Nanette Wade, who is the Chief Program Officer at Development Centers, Inc. For those of you who may not know, Development Centers, Inc. is one of the many so important resources, a community mental health agency, an integrated health agency that serves the city of Detroit as well as Wayne County. So, Nanette, this is National Mental Health Awareness Month. What can you tell us about that? And then let's hear a little bit about your thoughts about not only Mental Health Awareness Month and the impact of COVID, and particularly on women. Welcome.
Thank you so much, Janetta. I just want to correct just a little bit. You're speaking prophetically. I am not quite Dr. Nanette Wade yet, but I am Nanette Wade, the Chief Program Officer here at Development Centers, and it is a pleasure, truly to be with you all and to share a little bit about the residual effects of COVID-19 pandemic on the health and mental health of women. If you give me a minute, I will share my screen and let's see here.
You're almost there. But you know, I'm anointing you in the way that if we think about so many in our history have done, is to recognize expertise and professionalism that you've exhibited at a higher level. So maybe that professor title, that doctor title is right around the corner and should be anointed anyway, huh?
I receive it all.
There you go. All right.
Thank you.
You got it. Mm-hmm.
All righty, so I introduced myself, and again, I want to thank the presenters that have gone before me for providing such wonderful information and enlightening me on Cinco de Mayo. I truly appreciate the information. The last kind of 24 months have been a really big challenge, I think, for all of us. And that's just to say the very least. At the onset of the pandemic, I know that many of us were gripped with fear, anxiety, and panic. We had fear of loss, fear of death, fear of disease, and many of us were fearful of running out of toilet tissue. I believe now, as the representative from Detroit Health Department kind of shared, we're not in the midst of the pandemic. I believe that we are experiencing an aftermath of the pandemic, and it's what I call the residual effects of the COVID-19 pandemic. It's as if we're in an awakening where we're now realizing what has changed, and apart from the losses of life and of loved ones, of our work and our way of life, I believe that we've all really truly been forever changed, and that we are experiencing those changes throughout our bodies in one form or the other. And so we're talking about the effects of the pandemic, and for some of us, when you think about where you are right now, 2 years into the pandemic, you may still be experiencing some emotional distress, increased sadness, depression, worry, emotional outburst, kind of feeling a little temperamental. Some of us may still be experiencing increased irritability or anger, aggression, and still experiencing crying spells or annoyance. Some of us may not necessarily have the emotional response, but may still kind of deal with maybe sleep disturbance, not being able to get to sleep, or maybe disruptive sleep. Our eating habits may continue to be off sync, where we're eating too much or not eating enough or maybe eating the wrong things. Focus, inability to concentrate, not being able to kind of stay on task. Some individuals continue to complain or to talk about body aches. When you talk with people who have dealt with the COVID virus, you know, there's some long haulers and there's some individuals that still have some lingering impact, but others may just have body aches that's unexplainable. Then when you look at especially women and the toll that women really, the heavy lift that women really had during the COVID pandemic, we had functional disruptions at our workplace, family life, our social life, our spiritual life. All of those things were impacted by just the disease, the pandemic. Some lost their jobs. Some were unable to work because kids were home from school. You look up at family, those things then impacted your ability to pay your bills, your ability to provide for your family. The social aspect in terms of the isolation, not being able to entertain or not being able to really greet and have that human contact has its toll, it takes its toll. When you think about the spiritual aspect, many temples, mosques, synagogues, churches, you know, they closed down. And for some, they still have not opened to their full capacity and or have opened at all. And so we look at how then the pandemic had its initial impact that sent the world into a tailspin, more or less. But then as we began to think about the residual effect of coming out of the pandemic, you know, what are the things that we continue to experience? And then what do we do? You know, what do we do in order to try to counteract those experiences? How do we keep it moving? One of the things that I like to say is that we can't be passive in our own recovery. We have to be involved. And so when you think about how to counteract some of the physical effects of COVID, you really want to begin to think about, you know, are you getting enough sleep? You know, how do we then challenge ourselves to get enough sleep or even to recharge and to rest? Are we getting enough physical activity? A 10-minute walk, a 30-minute pace walk, yoga, doing the things then that will help strengthen us physically, which then also has its impact on us emotionally. Are we eating the right things? Science and research shows that what we actually put in our bodies actually do have an impact on the output, and not just the output, but actually the emotional output that we actually display towards others. Avoiding drugs, alcohol, tobacco. Science shows that those things do not help our anxiety as much as they cause us to fall deeper into depression and anxiety. Meditating. In our field, we have a practice that we talk about kind of pleasant imagery, you know, taking time to kind of recharge and just kind of imagine and to think about the things that allows us to relax, you know, sitting on the beach, listening to music, those things that we can then imagine and then kind of take us away from the chaos of where we are today. When you look at your emotional health, it's recommended that you create a routine and stick to it. The pandemic had so much uncertainty involved or enrolled into it that it now requires for us to have, it's good for us to have a routine and to stick to it. That way we do add some certainty back into our lives. Focus. focus on positive thinking, positive thoughts, the things that will cause us to have those happy endomorphins kind of show back up into our lives and in our bodies. Set priorities. Again, with the uncertainty that the pandemic intruded into all of our lives, setting some priorities and then taking some control in terms of what it is that we want to do and what we want to accomplish, and then sticking to those things. What are we doing in our spiritual, engaging our spiritual and our moral compass? When we feel good, when we do good, then it again helps us to kind of elevate those happy endomorphins, which then allows us to feel good, to treat others good, and then to respond in a positive way. Connect with others. The isolation was unreal. Connect with others that you may not have been able to see or to talk with, friends, families, helping organizations. I like to say that it's the strong person that actually reaches out for help. It takes more strength to admit where your weaknesses are, where your strengths are, and then to capitalize on them and to reach out to those that you know who can be supportive and be of assistance to you. Acts of kindness, not out of a duty. Us women, we do a lot. We contribute a lot. We offer a lot. We take care of a lot of people. But offering some act of kindness, not just out of duty, but just out of your humanity. Doing something kind for others, a kind thought, a smile. And what we find is that oftentimes it do more for you than it actually does for the other person when you can garner that type of strength to be kind. Looking at your self-care. Only a healthy, well cared for you can then help and care for other individuals. Recovery occurs one day, one moment at a time. And I do believe that we are stronger than we really think that we are. And for women, Janetta mentioned earlier that, we birthed life. And so we have that inner strength that's within us that we can pull on in order then to help us kind of through our recovery through this, this pandemic. Thank you.
I almost don't know where to start. You covered a lot of really such important background for us, from all the ways that, just as we said, women birth the world. And we really want people to understand and value women, because we are still, as a group, as a sector, not only in the United States, but worldwide, in too many places, undervalued, marginalized, and our voices and our power are not, and potential is not fully accepted or expanded upon. And the fact of how COVID has affected us. I mean, children have lost mothers. Mothers have lost their mom, who was Nana, who was the backbone of the family. But you've shared so many strategies too for us. I want to pause for a moment and see if we have any questions that have come in from the chat, or even any comments. I'm going to ask Deja or any of our other team members, do we have any questions that have come in for really that profound review that Nanette gave us?
None yet, none at this time.
Okay, thank you, which means that people are listening and savoring that. And thank you also for providing the slides. Could you, though, just for a quick moment, we've talked about women's health and we've talked about mental health. Could you give us an idea, when we say mental health, what's the difference between a mental health issue versus one where someone is trying to just feel better about themselves? Is it a continuum, or are there clear markers? What do we need to be thinking about when we want to help each other better understand what is mental health and what does that spectrum look like?
It's definitely a spectrum and a continuum. And I do believe that most of us, if not all of us, at some point in our lives have gone through an episode where we were blue, maybe had a struggle that we had some challenges contending with. I like to say that they say laughing is a mental health disorder in terms of the chemical changes that occurs while we're laughing. It's a chemical imbalance. And so to kind of make it where that it's really can be normalized, most of us, as I said, will have experiences where we're down. I'll just, in all transparency, when my daughter went to college, I don't remember that summer. I went to work, I came home, I completed all of my duties and all of my functions, but I really don't remember the summer. And so it was when she came home that I said to her, I think I was depressed, you know, not realizing that, you know, life transitions, we all go through transitions, you know, we all go through changes, and those things take their toll. And for those of us who are fortunate to have family members or friends that we can chat with and kind of talk with, who can give us their wisdom and their lived experiences, we're fortunate. For others, they may not have that. And that's when you reach out and you seek professional help. You seek the support of your pastor. You seek the support of a counselor. And when we talk about the continuum, that's just a little bit different than those who may need the assistance of psychotropic medications, where they may find that their diagnosis or that their disability meets the DSM-5 diagnosable disorder. And that's okay too, because there's help. You know, you can live with a diagnosis. You can live and have a productive life and take medication and seek counseling. It's all about your health, your recovery, and you doing what you need to live your very best life.
Thank you so much for that. And I'd really like to lift up to our families, because there's so many struggling. There's still stigma around mental health. And if I think back, roll back the clock 20 years, it's really no different. When I was in prevention in a community mental health agency, people were like, well, I really don't want to talk about it because I'm concerned that people may think I'm crazy. That still is there, even though people may not state it. You've said it's all about how do we love on each other, listen to ourselves, and reach out to get support. So families, if you are struggling, if you're trying to figure out how you're going to handle what's going on, little brother, cousin, uncle, you don't have to do it by yourself. In fact, quite frankly, you're setting yourself up if you try to do it for yourself. So know that you have organizations like community mental health agencies. Parents, talk to your nurse at your school-based health clinic or somewhere. Talk to your primary physician. Most primary care providers and pediatricians, they have behavioral health resources as part of their clinics. And also know that there's a whole group of also private practitioners and counselors that are there to help you develop strategies of how to breathe and stay focused on our health and our well-being. And more so than any other point in time, we know our mental health matters so much. Nanette, thank you. Go ahead.
I was going to say, I would just add, and it's okay.
To not be okay is okay. Wow, haven't we learned that? If there's nothing else that COVID should have taught all of us, is that your strengths can sometimes, they may not be strong enough, and you may be hanging on by your fingertips, and you might slip, you might fall, you might go under for a while, but that's okay, because stay focused on reaching out to others to help you navigate those changes. So we have to continue to support each other. Nanette, thank you so much for being part of the conversation. Thank you for lifting up the role of women, that is, and particularly our family members, women in our families, are so important to keep us grounded and keep us focused on that which keeps us healthy and well. And thank you for sharing your own story. Boy, could we do that around our COVID-313. So we're going to transition and thanking Nanette not only for the perspective about women's health, but we really want to move into a conversation that's so critical right now. And that is that many people have heard about the dire data that's always been with us around Black infant mortality. But we have also seen a shocking increase in maternity and mortality, particularly with Black women. And there's a whole set of reasons about that. And there's a whole set of reasons from structural racism and implicit bias, and also the environmental factors and the psychosocial dynamics of what Black women have historically had to contend with in the United States. But I don't want to talk about that. I want to bring to you one of our foremost organizations that has been laser focused on the health and wellness of Black women in particular, and that is Mothering Justice. And representing Mothering Justice today is Shanae. Shanae is going to have an opportunity. We're delighted to bring you forward to talk about what we should understand about what's going on with Black women's health, maternity, and more importantly, what are we going to do to change some of that data and make sure that our women are healthy and thriving. Shanae, welcome.
Thank you so much, Ms. Lily, for having me on today. I am Chanel Bennett. I am the Black Maternal Health and Reproductive Justice Organizer at Mothering Justice in Detroit, Michigan. And I'm just going to share a little bit of information on Black maternal infant mortality. Also, I'm going to share a little bit about the Roe versus Wade issue and how that affects us women here in Michigan, or birthing people in Michigan, and also how that affects Black women in particular. So if it's okay, I'm going to share my screen.
Yeah, please do.
Okay, thank you. And if you guys are like me, you have 80,000
things in your browser, right?
Yeah, things in your browser. So let me make sure I have the right one up. I believe so. I'm sure you guys can just see a bunch of stuff here. Let me know if you see anything.
Yeah, we've got you. You're all set.
All right, let me go back. And please excuse my lack of
You're doing fine.
All right.
And we can all see your screen. Thank you. Go ahead.
Awesome. Thank you. So for those that don't know anything about Mothering Justice, Mothering Justice is a grassroots policy advocacy organization that provides mothers of color in America with the resources and tools to use their power to make equitable changes in policy. We're dedicated to improving the quality of life for families in America by empowering mothers of color to take action on American policy on behalf of themselves and their families. So our mission is to empower mothers of color to influence policy on the behalf of themselves and their families. And our vision is that BIPOC mothers will be a dominant voice in policy making and change the conversation around what really matters in America, and lead an independent political system that gives decision-making power to families of color. So what needs action at Mothering Justice? We have a focus on paid leave, family leave, affordable childcare, maternal health and reproductive justice, and basic needs. And so all of these things on the side fall under those categories: perinatal mental health, access to adequate care in rural areas, acknowledgement of Indigenous practices. We make sure those are centered and respected. Adequate transportation, Medicaid coverage for birthing centers and certified professional midwives, extended time off for families suffering from loss, abortion, miscarriage, fertility loss of a loved one, those with disabled children, sex and family planning education, and dismantling a system that was built on white male supremacy. So how is infant and maternal mortality defined? Infant mortality is the death of a young child under 1. Maternal mortality is the death of, or refers to the death due to complications from a pregnancy or childbirth. The WHO and CDC has actually extended this period of consideration to up to 1 year after the pregnancy. So these are just some numbers over from 2018 to 2020. So as you can see, the burgundy area, that would be us. And so in 2022, the numbers right before the pandemic or during the pandemic, the numbers began to go up. So for a very small window, our mortality rates were going down, but during the pandemic, they actually shot back up. And unfortunately, that was due to several reasons, as some of the other presenters before me stated. Just the seclusion of the pandemic, the fear, the anxiety, took those numbers back up. Lack of having support in hospital settings. So whether that was a birthing person's partner, their doula, even staff, because we know there was a shortage of nurses and a shortage of staff people around COVID, or they were just wiped out with the other issues that were going on in the hospital setting, that kind of took the numbers back up. So in Michigan, our percentage is at 16.4 for maternal deaths per 100,000 births. And for those that don't know, that's just the percent overall. Black women, our rates are actually specifically higher. So we're at about 23.2%, which is astonishing. And I know it sounds like such a big number, but that is literally what's happening in Michigan. And then Detroit per se has their own set of numbers as well. So Michigan may have one of the longest standing maternal mortality review committees, but the legislation to make reporting on these deaths mandatory did not even pass till 2017. So just think about all of the people, the Black women and babies that transitioned before 2017 that we don't even have data on. That's a scary thought. Racial disparity is at the forefront of these cases in our state, where Black women are 3 times more likely to die during pregnancy and childbirth. And the Black infant mortality rates, especially in urban areas like Detroit and Flint, are higher than the national average. So for insight, people in dominant racial or ethnic groups make important decisions that affect everyone's lives. For example, they have a lot of control over the way the schools, healthcare, housing laws, law enforcement work. This control means that people in the dominant groups are more likely to have better education and job opportunities, live in safer environmental conditions, be shown in a positive light by media, such as television shows, movies, and news programs, and be treated with respect by law enforcement, and inevitably have better access to healthcare. In contrast, people from racial or ethnic minority groups who live in a racist culture are more likely to experience chronic stress, live in an unsafe neighborhood, live in areas that have higher amounts of environmental toxins such as air, water, and soil pollution, go to a low-performing school, have limited access to healthy foods, have little or no access to health care or health insurance or quality care, or have less access to a well-paying job. So being a person of color is not a cause for pregnancy-related death. However, communities of color are disproportionately affected by racism. Racism and unequal living conditions affect their health and well-being. This puts them at a higher risk of pregnancy complications, such as pregnancy-related death. And I would also like to mention, per the last slide, that maternal mental health and perinatal mental health is very crucial in our community as well for those same reasons. So when it comes to Roe versus Wade, we're still possibly under this Act 23 of 1931. It hasn't been repealed, but they're not prosecuting. So according to the law, abortions are legal in the state if they are necessary to preserve the life of the woman. The law does not allow for exclusions of pregnancy if a woman is raped or a victim of incest. But as I stated, the Attorney General Dana Nessel said that she was not and will not prosecute anyone using these laws, and they haven't been prosecuting anyone using these laws. So if Roe versus Wade is overturned per se, that would just leave it up to the states to decide if they would like to keep abortion clinics open and legal. So for now, abortion is still legal, but it's important to note that at this time, the issue of illegal and safe abortion goes beyond Roe versus Wade. It's an issue of accessible reproductive care for all, especially Black women and women of color. This is a right, and not necessarily because we may not like the overturning, but this is something we need because there's a community of people that depend on it. Literally, their lives depend on it. This centers the issue of Black women and women of color being policed, criminalized, and shamed for making decisions based on the system that was built to work against them. Black women experience more medical biases and discrimination. Our infant and maternal mortality rates are higher than any other color. And this is an intersectional issue and a human right of reproductive justice. So it's an adoption crisis, it's a housing crisis, financial crisis, whatever crisis you can think of, this issue intersects with that, especially when it comes to Black women and women of color. And that is it. I tried to make it very short, very brief.
That's a real challenge because this is such a critical issue. And Chanel, as you said several different times, you reference numbers. And so often what we do is we diminish people to numbers, but we're talking lives.
Yes.
And we're talking about, as you said, perpetual issues that the pandemic has only flared up even more, which means that we too, and like Mothering Justice, our coalition, many of us in this space, and also the Southeast Michigan coalition that has been working on infant mortality reduction for almost 15 years, all of us know we have to be laser focused on combating the underlying causes for the racism that we see. And these are symptoms of that. And, you know, if you've been part of a fetal infant mortality review committee or looking at maternal mortality. So what I'd like to ask you, are there any other resources that for people who want to learn more about how to combat this issue, how to become involved as an advocate, how can they reach Mothering Justice, or any other information and resources that you'd like to provide? Can you share that before we move to our closing?
Absolutely. So outside of being an organizer at Mothering Justice, I'm also a birth and postpartum doula. Yeah. So I've been blessed to be able to have access to more resources. So for maternal mental health, I would suggest logging on to psi.com. They are a very, very strong org on maternal and perinatal mental health. To get involved right here in the city, I would say reach out to Mothering Justice, and you can reach us at motheringjustice.com. And we're on all social media platforms as Mothering Justice, LinkedIn, Instagram, Facebook. I will also say we have a number of partners. We have Black Mothers Breastfeeding Association. We have Sister Friends at the Detroit Department of Health. We have the WIN Network at Henry Ford Hospital, who also has a maternal health program that consists of CHWs and community people who come together for the mothers who birth at that particular hospital. We have sistermidwife.com, where you can find a doula or a midwife in your area. We have Birth Detroit. Birth Detroit and Mothering Justice have just partnered together to work on creating a Michigan Momnibus.
I can't help but do this, right? As I say, buy the t-shirt, right?
Yes. So we have so many partnerships, and also I would say use your social media platform. If you need access to something, I promise you, if you just put that out there on your Facebook, on your Instagram, you just ask a question, somebody knows somebody who can lead you into the right direction. So create a village. When it comes to Black maternal health, that is so important to me. Create a village, and a village doesn't just consist of your partner or your mom or your dad. It could be anybody. It could be your neighbors, your friends. We've done, community baby showers. Black Mothers Breastfeeding Association, WIC, they do community baby showers as well. So these are things that are important. We have Mama's Mobile Milk. We have the IBCLCs of
because
color.
we know that breast milk is best.
Yes.
Mama's milk is best, right?
Yes. So we have a lot of resources in the city, you guys, and I know it's hard because sometimes we're not aware of the resources. Of course, I've had 3 kids and I wasn't even aware until I got into this work. So just continue to share and continue to ask. We have amazing Black physicians and midwives who care deeply about us and care about our well-being, and also know of these numbers and are doing their best to reduce these numbers as well. So thank you so much.
Thank you. I can't even begin to thank you enough for this. There are other programs, if I can lift up a couple. We also know there's Make Your Date. We know there's the Nurse Family Partnership. And throughout, not only in Detroit, but Wayne County and the state of Michigan, there are what's called maternal infant health programs, and that if you happen to be on aid, those resources are available for you. So I guess the message that we want to really make sure that we are sharing in this month, talking about mental health and then talking about the health and well-being of women, that there are an incredible number of resources that are actually available. So just like we get on Facebook, we use our social media to find out what's going on in Hollywood, find out who is a caregiver, who's a doula, who knows about one of the better primary care. Let's make sure that we're all connected to a medical home, or at minimum that we're connected to a fantastic midwife or a doula, so that we can have this net of support, so that all of our babies and all of our children and women not only come here healthy, but they thrive. So thank you so much now, and thank you for the work that Mothering Justice is doing. Thank you, Nanette. Thank you as well for the background on Cinco de Mayo, and all of us that are doing the work of bringing experts and information to keep us safe and to keep us powerful. So with that, we're going to go ahead and wrap up what I hope it was a program that was very enjoyable for you, with a focus on, yeah, you guys know what's coming, Mother's Day. And Mother's Day is not about Hallmark. It's not about what happens commercially and what you go buy. Mother's Day is the time that we pause and realize that no matter how we came to life, we came through a woman. As my father and my husband always say, all of us got here through a mom. And to them, we need to be grateful. And even if you are an adopted child or you're a foster, think about the person that's been nurturing you. Think about your grandparent, your auntie, Miss So-and-so down the street who's always looked out for you. We want to challenge all of us that are part of the COVID313 Coalition. We are going to do something special. And that is, we are going to all make it a point that we are lifting up the moms in our own organization and saying, thank you. Thank you. Thank you to our healthcare moms. Thank you to our teacher moms. Thank you to the moms who stayed at home and were trying to figure out how to do everything that they're doing through COVID and not having access to the digital resources that we need. Thank the nurses. There's so much for us to be thankful for. Hit pause. Be thinking about the magnificent moms that are in your life, no matter where they are, and send them a love note. And this is our love note to all of you from our COVID313 Coalition. Now we'd like to also let you know that there are other upcoming events that will keep you powerful and keep you informed. And as always, so pleased that we've got Deja Moss, who is our wonderful production and support coordinator, has a number of slides that we'd like to share with you. We have some upcoming events. We want you to know that while we're talking about health and mental health, many of you may not be aware that Michigan has one of the worst counselor to child ratios in the country. For those who don't know, Michigan is actually at the bottom 10th of the United States in literally all of our educational outcomes. So we've got a lot of work to do. But in particular, 42 Forward is saying we must have $300 million right now that our children need to have counselors in every single school, not only a counselor, but not a counselor that serves 300 or 400 children, but particularly through the pandemic, we know how important it is to have counselors, smaller numbers that counselors can get to know, love on, and support not only the child, but to know the family, because those are the things that we need for the continuity. Thank you. We've got it. We demand $300 million in counselors. And through the amazing amount of money that has been released from the Biden administration to the state and the state to local municipalities, the city government, county government, and school districts, the funds are there. So parents, families, advocates, let's push for it. Next slide. Continue the theme of social justice, because that's what we need. Change means that we are distributing the resources to the people that need it most, to those who've been marginalized and whose voices have not been heard consistently. So the Congress of Communities is always representing our community, and particularly our brothers and sisters in Southwest Detroit. I love this. They're doing a social justice after dark, Saturday, May the 7th from 3 to 10 o'clock. Please take this flyer, reach out to Congress of Communities, and let's have a social justice after dark, which means that we're hearing information, but we can also be edutained to get the information so that we can take action. Thank you, Congress of Communities. Detroit Parent Network has a number of activities that we're continuing to do through COVID. And one of them is that we do every week almost now. We call it Come Hear Our Stories. It's the opportunity, it's a listening session in which parents, young people, as well as trusted experts come into a space and have a conversation. This one that's coming up is a really important topic, and that will be looking at childhood obesity. We need to recognize that the health and wellness of our children, that their obesity is an issue, and it affects our oral health care. It affects our cognitive development. It's leading to more childhood diabetes and a number of factors. Let's come and hear the stories about how families have better understood how to address childhood obesity and change that trajectory of the health and wellness of their children. So join us on Friday, May the 6th. For those of you that have children that are in that age group of the 2nd and 3rd grade, literacy is liberation. That is our perspective. And the way that we can do that also is helping parents better understand the 3rd grade reading law. That law is still on the books, parents. So come and learn more information about what the law requires, not only for your children, but how you can partner with your teacher, partner with your school to make sure the resources are getting to your children so that they are not reading behind, but also so that there's no opportunity for them to be potentially held back. Please join us for that. And we welcome your voices. Let's learn about the 3rd grade reading law. Let's make sure that our legislators and our school districts are putting the money where it needs to be for the individualized tutoring and support that's going to make sure that our children are literate and reading at grade level. We have a couple of more slides. We ask you to hold on with us a little bit more. Last month was another, what we like to call an awesome month. It was a focus on autism awareness. And we've been zeroing in on recognizing that not only children who are in the spectrum of autism, but that we also have children who have unique abilities. We're trying to move away from that word special needs. I mean, we all have special needs. I think Nanette gave us an example. I can talk about in my life, different points in time. So we have some special needs. Yet we have children and adults who have unique abilities. And so DPN is holding a unique abilities talk. Come join us, get more information specifically about autism. And we're doing this in partnership with the Autism Alliance of Michigan. Parents, family members, professionals wanting to better understand autism and how we need to start early to better understand and potentially diagnose it, and how we can have wonderful lives and see adults who are awesome in their unique abilities having autism. We also are staying focused on, again, our health and wellness environmentally. So Detroit Public TV is zeroing in on our water, which happens to be Michigan's Great Lakes. You know, we've got water wars literally going on. And the fact that we have differences of perspective about our environmental needs, the needs of families to have clean water, and corporations that are using our water, but not doing it in a safe manner. There are what there's being called water wars. And so Detroit Public TV, PBS, is having a discussion this Thursday, talking about whose water, our water, and in particular, Great Lakes water. And that's going to be Thursday, May the 12th at 8 p.m. We have a couple more items, I think, from Detroit Public TV. And for those of you who are not aware, Detroit Public TV is part of the national PBS system. So parents, make sure that you are checking out the Michigan Learning Channel and all the wonderful opportunities. But also, if you've been watching these COVID313 coalitions, know that you can go to One Detroit and check out any number of the now over 100 COVID313 coalition town halls that have been going on since the middle of March. And since the middle of March, guess what? The way that we do what we do is we do it as a collective. So I'm going to ask that all of the members of our COVID313 is, if you can, come off of your, come onto a full view of you. We want to see your beautiful faces, no matter what your hair looks like, no matter what you're doing at your desk, is go ahead, light up the screen with the real you. Because we've been living in this rectangle world. Hey, Michael, how are you? And know also that we've got a DPTV group of awesome tech folks who keep us going every single time. And we just want to let you know, and to our interpreters, how much we appreciate you. Let's keep loving on each other. Let's keep supporting each other. Stay strong, stay powerful. We can do this for our families. Take care. And happy Mother's Day to any and